this is the first portion, can get that as well. But thank you all who have joined so far. Again, today we're talking about how to attract more patients for your behavioral health practice, reduce admin work, etc. Basically, we want to talk about the power of an integrated solution for behavioral health, obviously through Opus's EHR, but we want to talk especially about Opus's CRM today. So let's go ahead and jump right in. As for an agenda, we'll go over an introduction. We'll talk about common challenges that people face in behavioral health, and then we'll talk specifically about what is Opus CRM. Talk about how Opus CRM can help you to attract more patients, reduce admin work, improve efficiency and productivity, and talk about some real-world success stories, key features of the CRM, what kind of ROI and cost savings, the integration and ease of use, and of course, security and compliance, because that's important for the industry. We'll then go over a quick demo and we'll do a Q&A. I'm going to go ahead and put a poll together right now so anybody can ask any questions they have, but feel free to ask questions throughout the presentation, and we'll try to answer them when we can. As for our introduction, what is Opus and Opus CRM? It's a fully integrated solution designed specifically for behavioral health practices and providers. We streamline patient acquisition, admin work, marketing, and operations, so you can spend more time focusing on helping people as opposed to having to do all the admin work that goes with running one of these practices. Objectives for this webinar is we want to understand the common challenges in behavioral health. We'll discover how Opus and Opus CRM can help you to grow your practice, and then we'll talk about some real-world results and key features in action. So common pain points in behavioral health organizations. Obviously, we talk to a lot of behavioral health organizations, but most people, before they start with Opus, they struggle with patient acquisition and retention. Admin takes up a lot of time that could be used for helping patients. And then there are some inefficiencies in billing and reimbursement, maybe some compliance and documentation burdens, having to manage a lot of that documentation yourself. And then, of course, lack of data-driven insights for decision-making. So Opus and Opus CRM is essentially an all-in-one integrated solution. We've got an EHR, an RCM, and a CRM platform, and this helps you to, with the marketing automation software, to connect every part of your practice into a seamless system. The benefit of this is rather than having every part of your tech stack in a silo, you are able to have everything integrated perfectly. That way you don't have to worry about hiring people to integrate specifically, and you can focus more on patient care and less on that admin work. And I'll turn the time over to Nick because he is our CRM expert, so he can talk more in depth about Opus CRM.
Thanks, Sean. Welcome, everybody. Let's look at what a CRM does for a practice and how you can leverage the Opus CRM. Currently, any clinic that that's operating in the behavioral health space, you have a bunch of different places from where you are attracting potential patients. Word of mouth, people finding you on your website, if you're doing any kind of marketing outreach through Google ads, Facebook ads, patients that are coming to you through different referring providers. The idea of having a CRM integrated with the Opus EHR is to provide you with those acquisition tools that can help you engage better with your patients, your potential patients or your existing patients, whether it is through automated follow-ups, whether it is nurturing them through a course of time, through different kinds of educational emails, contents, newsletters. How can we help you build out very powerful marketing campaigns in terms of increasing that engagement with these patients, giving you the ability for providing patients to self-schedule online, making sure that they are reminded of these appointments that they're scheduling with you guys. How can we help you build a very robust referral management process within your clinic, engaging your referring providers at different, whether it's through in-person meetings, whether it is keeping them updated about what's the journey been for their patients that they refer to you, keeping them engaged for better referral numbers coming your way. and also making sure that your patient outreach strategy and your engagement workflows are very customized to how you operate your clinic. One of the key things to remember is that a CRM does not, you don't have to change your business process to accommodate a CRM or a software platform. The CRM has to adjust to your business workflows, and that's exactly what the Opus CRM does. How can we help you reduce admin work leveraging automation? Right now, automation is a very large umbrella, but let's look at specifically for your clinic, specifically with admin work. Key things: one, scheduling and reminders. That's one of the key things where a lot of times practices have to spend in time to make phone calls, follow up with patients. How can we automate that part of the process through emails, phone calls, text messages? How can we make sure that the intake paperwork that the patients are supposed to fill out can be done digitally before they're coming in for their appointment? They can upload their documentation that they need to. They can sign any kind of consent forms, HIPAA forms, right? Anything that you need signatures on. How can they do that digitally before coming in for their appointment? So you've already prepared for that. How can we have automation drive your follow-ups to reduce no-shows, reschedules? How can we leverage automation for re-engagement with potential patients that have come to you? Somebody reached out to you 3 months ago, they filled out a form on the website, but haven't really, follow-ups since then. How can we re-engage with them using automation? How can we provide you with a multi-channel outreach strategy built around emails, phone calls, text messages, leveraging all of these 3 different channels for a very seamless communication outreach plan? And lastly, a lot of time that admins end up spending is verifying eligibility, verifying insurance. How can we automate that process to give you a robust document that tells you exactly what they're eligible for across their insurance plans in just a matter of minutes, right? And then making sure that the claim submission are going through seamlessly as well. Now, focusing on improving efficiency and productivity. Right now, the CRM primarily helps you streamline a couple of different things. Dashboards that are telling you at a clinic level, right? What are the key insights you need to look at from a efficiency standpoint, from a scalability standpoint, from a productivity standpoint across departments? What are the key metrics to look at through very robust dashboards? How can we automate the tasks and capturing the outcome of each engagement that we're doing with patients? If it was a phone call, if it was an email, it was an initial consultation that they came in for. What was the outcome? How can we streamline that, the capture of those outcomes? How can we make sure that our custom workflows based on your business process to optimize the care coordination, the episodes of care? How can we capture that? How can we make sure there is seamless collaboration between intake and insurance verification teams and billing teams through messaging internally? How can we drive a lot more systematic outcome-based decision driving process, leveraging automations to increase that efficiency and productivity? Looking at a couple of different, case studies from our past customers, what they've gathered as outcomes using the Opus CRM, using the CRM and an EHR integrated together. We've had a behavioral health provider that saw a boost in responsiveness by over 40%. It allowed their team to engage more efficiently with their patients, double the number of client inquiries that they were getting because they were able to track everything that they were doing on their marketing execution through their agency partners. They were able to see in real time how many leads they were getting through a Google ad campaign they were running versus how they were looking at organically that they were driving patients coming to them. So they saw a significant boost in that number. On the other side, we had the behavioral health tech company that reduced that turnaround time of converting patients from the time that somebody filled out a form on their website to getting an appointment scheduled. They saw a tremendous amount of reduce in timeline on that. And they saw 100% visibility into every step of their client's journey. They knew exactly where they were losing out patients. They knew exactly where they were losing out on leads, and they were able to turn that around through automated workflows and overall reducing their timeline on reaching out to patients. I think one of the common themes that we're seeing post-COVID is, and I'm sure everybody who's attending the webinar today might, on your personal right, not just with respect to healthcare, but everywhere, we are now glued to a phone to saying, I want to see a behavioral therapist near me. And the minute you click on search, it gives you 5, 7 different options, right? As a patient myself, I'm going to go to the first 3 and I'm going to fill out a form. And whoever reaches back out to me, the first 2 people to reach out to me are going to have my attention. Everybody else is probably going to be on the back burner. And those are marketing dollars that you're spending as a clinic to be on that sponsored link. That's your ad that's coming up right on top. So making sure that you have that patient's attention within those first 2 or 3 minutes from the time they fill out the form is absolutely key. And that's where the CRM will help you in making sure that process is absolutely efficient.
As far as key features, Nick, could you run through these as well for the CRM?
Yes, sorry. Some of the key features to look at is powerful automations and predictive analytics to tell you what's the process been so far, what are the outcomes you're tracking so far, how can you instantly look at that metrics and change on a day-to-day basis, right? How can you become better using that powerful automation? The seamless ability for communication tools through emails, phone calls, text messages, chatbot, a very customizable CRM based on your practice's specific needs and business workflows. Like I said earlier, the CRM adjusts to how your processes are built out. So they're very customizable. You have an integrated solution across billing, scheduling, documentation, and your EHR. So it becomes like it gives you a complete 360-degree view as a solution about your patient.
Now, as far as the ROI and cost savings for Opus CRM, the main ways that Opus CRM increases revenue is we reduce patient acquisition costs with automated marketing. I know that Nick had been touching on the intake and with the acquisition. We also help to decrease claim denials with optimized billing, cutting down on admin workload and saving staff time, and of course, increasing that patient retention with those engagement tools over time.
And just to add to what Sean mentioned, right? I think one of the key aspects on ROI is if you're already looking to, or you already are spending a lot of marketing dollars, to know exactly what your ROI was on that spend, whether it was a Meta ad campaign or a Google ad campaign, or you're doing a lot of SEO on website optimization to have your contact us form very easily available. Knowing what that conversion looks like in terms of revenue is definitely key. And that's where a CRM comes into the play and helps you get better idea that, hey, I'm running probably 5 different campaigns right now, but I'm getting the most value out of a Google ad campaign. And I might want to double down on my dollar spent on that, then spending it on 3 other different campaigns. So getting that ROI insight is what is one of the key things that we can help you on the CRM front.
I think another important point that we haven't quite hit on yet is that if you are already using a CRM like Salesforce, switching to something like Opus CRM can save you a lot of that money, as well as far as customizing the platform for your practice's specific needs. You won't need to hire an external consultant in order to do that. Our team is able to make sure that Opus CRM is fit specifically for your practice without having to spend those thousands or hundreds of thousands of dollars on Salesforce and optimizing that for your practice.
Great point, Sean. I would absolutely agree.
Now, as far as integration, ease of use, of course, we got Opus CRM, and Opus RCM. The main benefits is that there's an easy onboarding process and training for your staff. 80% of it comes out of the box, set up. And the last 20% is just customizing for your practice's specific needs. But the fact of the matter is that rather than having an isolated system, everything is already integrated so that you don't have to worry about integrating the platforms yourself. As for security and compliance, obviously we need a HIPAA compliant software and security data management for this. So that's where Opus CRM comes in. Nick, do you want to touch a little bit on the security and compliance within Opus CRM for behavioral health?
Yes. So we are HIPAA compliant, we are SOC 2 compliant, we're ISO 27001 certified. Every client that comes on board is in a dedicated HIPAA cluster. So you're not sharing your data with other clinics as well. It's very secure, with only you having access to live patient data. Our team on the back end is primarily working with you on the support side. Once you go live with the platform, only you will have access to data as well. I know one of the key things that comes up is, primarily around data migration, making sure that, you have control over data. So all of that is taken care of under the under our data security protocols. Couple of quick questions that I know that have come up. I'll try to answer them really quick, Sean.
Sure.
Do we have any standalone inpatient hospitals in California? I'm sure we can look at, if we have specifically in California, but we do have customers both on the inpatient side and also on outpatient, where they're using a front-end CRM and they're using EHR hand in hand, and we're helping them scale across departments and across the entire hospital system as well. Talking a little bit about insurance verification, can I provide details on inpatient eligibility in an automated fashion, specific to psychiatric services? So the way we do insurance verification is we primarily have an inbuilt functionality where we have a robust list of all private and public copay payers that we already have listed. And I'll be more than happy to share, like an example eligibility document that comes up that talks about everything in terms of copay, dependencies, everything that's covered, not covered, across different services and different payer types. So happy to share that as a follow-up with the entire group.
Great. Nick, can you share your screen for the demo?
Yes, let me go ahead and share my screen. And Sean, it says I don't have the option to share my screen yet.
Let me see.
Yes, now I do have that option. Let me go ahead and share my screen. I'm hoping everybody can see my screen.
Yep, I'm seeing it pulled up.
Okay, perfect. I'm going to try and walk you guys through a really quick demo, and I'd be more than happy to obviously, set up individual demos with everybody who want to look at a little bit more deeper. But quickly looking at when you log into the Opus CRM, you get this really cool dashboard, which is very customizable, specific to the kind of data that you would like to see. One, you're seeing different kinds of, ability to track where you're getting how many patients from across all your different sources that you're tracking. You can get a list view, a pie view, a table view. You can look at your overall pipeline. How many patients do you have currently sitting at which stage of their patient journey? You can look at a day-wise outreach as well. So you can track how your team's performing on their outbound, reaching out to these patients across on a weekly basis, daily basis. You can look at from a referring standpoint, you can see how many doctors and how many clinics are providing you referrals on, on a month-on-month basis. So you can keep a track of which referring organization is sort of, more sending you more leads, etc. You can see how your landing pages are performing as well. So if you have different landing pages for, a contact us form on your website or a patient referral form, you can see, what your submission and your views like and your percentage of conversion on that as well. Your marketing teams will really love this kind of data. And you can see how your task is being performed as well across all your different team members. So this is just a high level on the kind of dashboard that you can create and data that you can see. If we quickly look at how data is segregated in the CRM. So if you see here, you have a specific tab for all your referring providers. You can manage that data, all the referring organizations, and all your patients. So you can see that bifurcation right here. If I look at individual doctors as well, so these are all my referring providers that I see right here. These are all my referring organizations. I can customize the columns that you see in terms of data that might be most relevant to you that you're seeing every day, right? Which, what's the the organization name, what the type of organization it is, etc. Now, if I had to look at a quick view, let's say Kenneth Healthcare is one of the organizations that provides your hospital or your practice a lot of the referrals. You can see the provider that your team has been primarily been seeing a lot of these coming in from. If I go ahead and I click on that particular doctor's profile, I can see all the doctor details right here. I can see their provider type, all the other information, their name, email address, phone number, etc. I can see the activity in terms of my engagement with this doctor on an ongoing basis. I can see automated emails going out to them as soon as they submit a referral to you. We can see that a new patient was created right here with all the details about the patient. We can see that an association was created as well. So these are the different patients that Dr. Shane has referred to your clinic. So what you're seeing here is a 3-level association between the patient, the referring provider, and the referring organization. If I go into, let's quickly look at any of these patient profiles as well. So this is Ben L, one of the patients that came in as a referral. I can see the associated doctor that came it through. All the details about that is available here as well. I can see any, if they sign up for one or more services, then that can be tracked as an opportunity. I can see all the tasks that are created that are due, overdue for Ben as a patient, any notes that the team might have been added, any documents that have been received from Ben as a patient or, that has been come on board. And I can go back and I can see that association as well, who Ben is connected to. So I can see it's to Dr. Shub, and I can see the referring organization as well, if that's mapped in the system. This is a holistic view of all my patients. Again, very customizable. You have filter options right here as well. I have the ability to make a phone call, do an email, do a text message, all through one click. I have the ability to click a button and send this data into the EHR as well. And once I do come here, I have the ability of adding a task for myself also. I can see other information like what kind of services have they been referred for, referring provider, what's their contact preference, email, phone number. I can see a lot of other data that I would like to have my team see when I'm creating this window right here. Now, on a day-to-day basis, if I had to quickly look at how can I optimize my team's time, we've created a dedicated view called as a smart view. What the smart view does is it breaks down the different parts of somebody's day into small individual buckets. So as an intake person or a front desk or a call center rep, when I come in and log in onto the Opus CRM, I want to see all my new inquiries that have been assigned to me automatically. I want to see the ones that are pending their pre-assessment. I want to see those who are pending their insurance verification, those who have completed their verification of benefits. I want to see those that I need to follow up with. So each of this is categorized and the back end is triggered through an automated workflow that is tracking what happened as an outcome of each of these different individual tasks. So for example, I have Oliver Jane, which is one of my prospects that has been assigned to me as an intake person. All I have to do is can go ahead and make a phone call, send an email. And once I'm connected with them, I simply come here and mark this as complete. It gives me an option to add more information, certain fields that you would like to have mandatory that have not been filled out. I can go ahead and do my selection right here, update certain information, and put in a disposition as to what happened on that call, right? I got connected with them. I go ahead and put in more information. I'm going to go ahead and put in test right now. Say cities, Edison, Jersey. We're going to go ahead and put in test. Now, as I go forward, I have all of these different types of information, and we've already pre-built this, so you can just go ahead and make changes wherever you feel is required, and you can complete this form and have that as submitted, right? Now, once this is done, the identification of this task being completed and whatever has been put as an outcome will derive what happens next as part of that patient's journey. Do they go into the pre-assessment stage? Do they go directly to their insurance verification stage? That's completely up to you. So if I look at a pre-assessment form, that could look completely different, where I'm now gathering multiple pieces of information. So you see, based on a selection, those additional tabs open or don't open, defining what happens next. So I can go ahead and I can capture a lot more of this information across their medical history, so on and so forth. I can add notes, I can update documents, etc. Again, this is customizable based on your current intake forms, pre-assessment forms, etc.
Nick, it looks like Todd just asked, can the text boxes of something like race or ethnicity, et cetera, be searchable drop-down choices?
Yes,
Okay.
absolutely yes. If you already have those predefined, we're more than happy to make that just a drop down, select, and move forward. And just to also highlight, and that's a great point, Todd, we can also go down to granular considerations, like if I select A, then I want those specific subsequent options to open that are relevant to A as a selection in my next dropdown. So we can have a lot of dependent fields open up based on a previous selection. Quickly to look through some basic marketing functionalities that you have available, right? So you can create these landing pages and these different kinds of forms that can be embedded on your website, whether it's on a WordPress website or Wix, anything that you have, where we can gather multiple such information. Like this is an example of a form for capturing referral that's coming in. This is for somebody who is filling out a form themselves and scheduling or trying to reach for an appointment. To quickly look at automations, right? We've spoke a lot about automations throughout the presentation. So let's look at automations as a tool and how that can help you streamline operations. So for example, this is an example of what a potential patient's intake journey automation could look like. So as soon as as soon as a patient profile gets created within the CRM, these triggers are taking place in real time. It's sending out an email, automated email saying, thank you for your inquiry. It's then going ahead and sending out a text message as well. It's also now going to track what was the outcome of this email. Did they open that email? Did they click a link that you may have embedded in that email? Based on those actions, you could have certain triggers that are happening as part of the automation. On the other side, this part of the flow is already going on, which means you're distributing this to somebody in your team. You're creating a task for your team member to know this has been assigned to you. You need to go ahead and complete this task of a phone call. You're going to wait for one day and give your team that time to complete that task. And then you're going to see what happened as an outcome. If they did complete that task, you update the stage. You create a new one, which is the next step. If they've not completed the task in one day, you notify them through an email saying, hey, this is pending for you to complete. Go ahead and do that. You then give them a limited amount of time, like an hour to complete it. If they still don't complete it, you go ahead and re-sign it to somebody else in your team. So you can control the timeline in which you want your team to reach out to these patients that are reaching out to you. Simultaneously, you're adding them to, let's say, a marketing list of, these are all our new inquiries that are coming in. These are those who are signing up for a newsletter. And then you're also updating the source from where you received this patient coming in. Did it come in through my website form fill? Did it come through through a potential ad campaign? Did this come through a referral source, etc.? Another kind of an automation to look at, when an automation gets created, which is a patient, you can have a more smaller automation as well. If we look at an episode of care automation, right? There's an activity that takes place of an episode of care. We're evaluating that data that's coming in from the EHR. And based on that, we are triggering, if the call disposition is connected as an episode of care, the pre-assessment needs to go out. If it's not connected, or it went to voicemail, or it was called back later, then the follow-up task needs to get created based on that as a trigger or as an action. And if no conditions are met, the lead will just directly flow into a different bucket. So these kind of very different, robust automations can be created on the back end throughout your process, throughout the entire journey of patient that they deal with you both on the inpatient and the outpatient side. To quickly look at our marketplace, so you have a lot of these built-in connectors and functionalities that are available to you across all of these different categories, whether it's syncing your email, Gmail and Outlook, your calendars, whether it is online ad platforms, right? So we've spoken a lot about Facebook, Instagram, Google, being able to track all of that that's coming directly from those functionalities, giving you the option of very robust telephony systems. So if you already have a VoIP telephony system you want to continue using, we can integrate with that, giving you the option of click to call, texting, all within the CRM itself. We also have native functionalities available that you can leverage across the duration as to how you want to optimize your solutions. So a very robust marketplace which is ever evolving. We have a dedicated team of engineers that continue to work on this, add more connectors available to you. And quickly to look at on our marketing functionalities, so you can do email campaigns. So if your team is currently using tools like MailChimp, Constant Contact, all of that can be bought into the CRM itself as a native functionality. So you can leverage that for doing your robust email campaigns. You can create drip campaigns within the same platform. You can do landing pages, you can do website widgets. And then, of course, we have our reporting segment that gives you the ability to use data that is in the CRM, that's captured through your marketing, through outreach, and data that is coming in through your EHR as well, to build out really robust reports that you can create across all of these different categories that you're seeing on your left. So whether you want to see how your email campaigns are performing, whether you want to see insights on your leads, right? How many leads have we not contacted? How many do we have duplicates? How many do we have at a marketing level funnel? What's my pipeline like? If I wanted to see how my website and my landing pages are performing, right? I want to do a lot of tracking in terms of, UTM tracking, my campaign source tracking. So a lot of these robust reports are available. We also have a module which gives you the ability to create your own report, right? So you don't need a separate BI tool. And if you are looking to leverage just the data between the CRM and EHR, you can actually just use this module to build out your own reports as well. So that was a quick walkthrough. I'm happy to dive a little bit more in depth on demos. So feel free to reach out to us, to me or Sean, and we'd be more than happy to set up that demo. I'm sorry if I missed out on any questions that may have come up later as well. Sean, if there were any more questions on the demo.
Yeah, I haven't seen any other questions come through besides the one from Todd. So I'd like to open up the time for any questions anybody has about anything we talked about. As a reminder, I have recorded this meeting, so I'll be sending the recording to everybody here and anybody that wasn't able to make it. But if anybody has any questions, now would be the time. Seems like Nikki did a great job explaining Opus CRM, so nobody has any open questions yet. But
or I really bored everybody to death.
Hey,
one of the two, right?
We're still here, right? We're still here. In that case, if nobody has any questions, as Nick mentioned, we'd love to go over a demo with anybody here. You can feel free to scan the QR code to get that scheduled. But yeah, we can talk about Opus CRM, Opus's EHR, or any other part of Opus with anybody here. If you scan the QR code, that'll take you to a meeting scheduler and we get that on your calendar right away. But yeah, I wanted to thank everybody for their time here. I appreciate everybody joining this webinar and talking a little bit more about the Opus platform. But thank you all, and we'll end this meeting a little bit early. But again, thanks, and feel free to join the hundreds of behavioral health professionals who use and trust Opus to grow their practice, whether that be Opus EHR, Opus CRM, or another part of our platform. So thank you all.
Thanks so much, everybody. Have a great day.
All right.